Hi guys, this is Dr. Elizabeth Baus at Integrated Health Solutions, and I'm going to talk to you about the blog this month about when is rehab beneficial. So to start out, we're just going to go over sort of the purpose of rehab. The purpose of rehab can be multifactorial, but essentially it's returning people to function. So optimizing function, correcting the function of joints, muscles, reducing trigger points and tension in muscles, reducing pain, as well as the likelihood of future pain. It can also reduce that as well. So rehab can be useful in many scenarios, but some of the common ones that we see here at IHS are going to include after a car accident, after any kind of trauma. So it could be a fall, it could be during a sports game, it could just be slipping on the ice at home. Very often you don't feel that in the moment, but sometimes a couple months down the road, you have an imbalance that's occurred because of that fall. It's also very helpful to have rehab following pregnancy. There's so many changes during that time, and getting back to moving well and having that core stability is really key, just for moving around in general, but also for future pregnancies. The final reason people often come in for rehab is muscular imbalances. So these are commonly from imbalances in the training program, so an uneven training program, as well as it could just be from a job. A lot of people have jobs that have very repetitive tasks, and that task takes a toll. Even if it's just sitting, if you sit every day for a long period of time, years and years go by, and you're not undoing the sitting, then it takes a toll after a while and creates imbalances and inactivations in the muscle, so you no longer are using your body in an ideal way, in the way that you're supposed to. And that can cause muscles to be tight, that can cause a lot of pain, and eventually like real injury. We're also gonna go over rehab at Integrated Health Solutions, which is specifically using this 4-step progression. So we have this beautiful blend here of dynamic neuromuscular stabilization and SFMA, which is a protocol that looks at classifying movement patterns. And we blend those together to make a great rehab program that sort of literally starts you at the ground up. So the 4 progressions would be starting with exercises based on what the patient needs on the ground and focus on stability. Then next we move to quadruped, so on hands and knees, and we do exercises in that position with increasing difficulty. Following that, we move to a kneeling posture, and finally standing, so that you can learn the pattern that you need in all 4 progressions, because it's very difficult to go right to doing it properly in standing. So we empower patients by teaching you how to do it in a way that you can do it correctly at home. And finally, we'll go over a recent patient who kind of embodies all of these that we're talking about, not so much the pregnancy, but the muscular imbalances and going through the 4-step progression as far as rehabilitation and exercise and getting a great result, and how that's something that you can have too. Thanks for listening in. If you have any questions, please reach out. We'd love to help. This is Integrated Health Solutions.